once you've completed that, now you're ready to start your plan and develop a roadmap. So we went through that pretty quick. The assessment phase is a lot of detail and a lot of information to go through. Getting to your roadmap is now you're starting to set your plan for the ICD-10 compliance timelines. You're going to determine your approach for education, your training, and your change management. Plan for modifying your systems to accommodate your code structure and all functional systems. If you need to modify your business processes, plan for that, because that can take longer sometimes than what people think it will. And determine approach and timing for updating analytics and reporting to support the effort. And again, this roadmap is usually set by your project manager at the direction of the key stakeholders. And that's a lot of data coming in to develop this. Gary, did you have anything else to add on the roadmap?
No, not this time. Thank you.
So basically, play offense and get started now. Here's just a high level. To do your impact analysis is 3 to 6 months. Contacting your vendors is another 2 to 3 months. Contacting your payers, billing service, and clearinghouse, that's 2 to 3 months. Now, granted, some of these things can be done in parallel and that you can be working on at the same time depending on your resources. If you have multiple people that can help with getting this work done, then some of those, it may be 2 to 3 months for completing both contacting your vendors and your payers and all that. Installing your vendor upgrades, 3 to 6 months. And also know that part you're really dependent on your vendors. If they're not going to have the upgrades and remediation available till March or April of next year, then that's when you're going to have to plan that upgrade for that system. The internal testing is going to be done at the end, of course, and so that's a 2 to 3 month process that, as Gary mentioned earlier, that is an extremely important piece. And as you know, there's a lot to test with all the different systems in your organization. You're going to be updating your internal processes for the ICD-10, and if it changes any workflow that falls out of that. And then you're going to conduct your formal staff training. That's a 4 to 6 month project that needs to really occur throughout the entire phase. Do you want to add anything to that, Gary?
Well, I just think that, and thank you, I think that the idea of training here is because ICD-10 literally impacts every constituent of the healthcare community beyond just our typical coders and billers, et cetera, getting a lot of updates on the new codes each year. The idea of we'll just bring somebody in to do a class or two is not as feasible as it used to be, considering the scope of this project, and that I think a blended learning solution or blended training solution should probably be considered. What I mean there is, instead of finding out when experts, either internal or external experts, are available to provide training, having access to on-demand e-learning so that people can get the information when they need it, where they want it, on whatever device they want it on, and more importantly for adult learning, that they can go back and revisit it, and the repetition can create some behavioral changes, if you will, related to this. And I just wanted to consider that would be something that is identified as a longer-term process, as opposed to we'll send somebody to class for a couple of days. It's a little bit broader than that. Thank you.
Thanks, Gary. And that brought up one point that I did not bring up in the very beginning with your key stakeholders. There's a good kickoff training to make sure everybody's up to speed. We understand coders understand this, and we understand that management, for the most part, understands what this means. But sometimes when you get down into the ranks, your IT people are just as important to understand the impact this is going to have, and they may not see the big picture. And so it's making sure that you get your organization trained at the appropriate level, as Gary said, and to understand the impact this has for the entire organization and what their small piece of contribution is going to be to make sure it's successful.
That's right, and you brought up one item, and I don't want to slow you up here, but I was in Oregon doing some rural health work, and An IT gentleman was there and didn't realize that ICD-10 October 2014 should be seen as the starting line, in my opinion, rather than a finish line. He was under the impression that once they flipped the switch on ICD-10, that all the ICD-9 codes would go away from a master data perspective and needing to be accessed on workstations, et cetera. It needs to be recognized that you need to maintain and have access to ICD-9 codes for a year or two after ICD-10 goes into play, whereas he was of the mindset that it was going to be one or the other. That's a pretty major light bulb that went off with him that kind of gave him a more accurate picture of the scope of what's going on. And had he not heard that, who knows how long it would have taken to really have him recognize that's really kind of going to be his reality over the next 2 years. So, it takes a little bit to make a big impact, and that was one example.
Absolutely, good point. And then, of course, external testing is the next one down there with your clearinghouses and billing services and payers. And that's something that's going to happen again, kind of at their somewhat on their schedule. You can try to drive that schedule, and you really will have to have somebody that's staying on them to try to accomplish all this, because they're not always going to want to meet your schedule. So it is a lot of back and forth.